The science of sleep is young. Most of the scientific information on sleep has only been gained in the last 28 years. But one center in the Philippines has already caught up with a modern study of sleep. Welcome to St. Luke's Comprehensive Sleep Disorder Center, the advanced facility that offers the most comprehensive range of services and treatments for adult and pediatric sleep disorders.
Actually, there's no real statistics that's present in the country because there's no statistics being done yet. In the sleep center, where we have majority of the patients that come in, 97% of them actually have a sleep problem, and most commonly it's about sleep apnea. A big percentage of them coming in here are people who complain about snoring. Actually, their wives complaining about them snoring and having very sleepy during the day, which affects their work. When they drive, they fall asleep, they have a problem concentrating, they have memory loss, they become forgetful, some of them become moody. When it comes to children, they have behavioral problems. They are hyperactive, they're irritable, and in school they perform not so very well.
The Comprehensive Sleep Disorders at St. Luke's Medical Center, Quezon City was established in 1992. It was the first sleep center to be established in the Philippines.
It was actually a doctor from St. Luke's, Dr. Felicidad Soto, who's a neurologist who pioneered sleep in the country. It started first as a small laboratory. They do sleep tests during the night, and in the morning they do EEG, brainwave activities. And then eventually it expanded, got a lot of patients. It went down. They opened another laboratory, which is now known as the Comprehensive Sleep Disorder Laboratory, back in 2000. And that time, it was the biggest sleep lab. It was the first. We have a 2-bed capacity. And in 2006, it became a 3-bed sleep center. And now, with the new hospital, we have 5 beds. So far, we're the biggest in the country that caters to most of the patients who have sleep problems.
It aimed to provide comprehensive management of patients with sleep disorders. It relies on a team approach. It consists of pediatric and adult pulmonary specialists, neurologists, psychiatrists, and ENT specialists.
The science of sleep is multidisciplinary. It is only at St. Luke's Medical Center that one can truly receive a comprehensive treatment of their sleep problem through its expert centers of excellence. The Comprehensive Sleep Disorder Center diagnoses, treats, and manages more than 80 different types of sleep disorders in its state-of-the-art sleep laboratory.
The sleep laboratory, you come in for an 8-hour overnight sleep study, and we call it an 8-in-1 study because it studies the brain waves, the eye movements, the nasal airflow, the oxygen saturation of the blood, and then it also has an electrocardiogram, and then it measures the breathing movements, both the chest and the abdomen, plus the movements of the lower extremities or the legs.
So far, among all sleep centers that are in the country, we have the latest machine installed. It's the only facility that has carbon dioxide monitoring during sleep, which is very important when it comes to children, especially in children, because in children it can detect even if they have a very slight dip in the oxygen. You'll see that they retain a lot of carbon dioxide, and that can actually be a deciding point whether you intervene with the child or not, because with children they have a bigger potential for cure.
These sleep studies measure various functions of the body, which include brain, heart, lung, and muscle activity, in order to determine the sleep quality of an individual. The results of these sleep studies help diagnose a wide range of sleep disorders that would result to abnormal sleep. Generally, They would be classified to those who sleep too much, those who sleep too little, or those who have abnormal activities during sleep.
Snoring occurs when there is too much or too relaxed, smooth muscles in the neck so that the airflow vibrates when you pass air in and out of the throat muscles. Sleep apnea is the worst end of the snoring spectrum, and it causes the patient to have interrupted sleep or non-restful sleep because the oxygen level goes down while you are sleeping, and the body tries to wake you up to maintain this oxygen level in the brain and the body. Insomnia is the most common sleep disorder, and it is the patients are unable to sleep or to maintain a good night's sleep, or they wake up early given a chance to have long sleep. Restless leg movement disorder is caused by patients complaining of discomfort when at rest, and it occurs as they try to go to sleep. So they try ways to relieve this discomfort or restlessness by walking around, thus making it difficult for them to fall asleep. Narcolepsy is uncontrollable sleepiness during the day. It is caused by a problem in the hypothalamus or in the sleep centers of the brain.
Basically, sleep disorders are classified into if you're having too much sleep, you sleep all day long, you sleep at night, you sleep all day, and those who have problems in falling asleep, or they can't sleep for a very long time, or they have abnormal sleeping behaviors like you have nightmares, you have night terrors, okay, or sleepwalking sometimes, or teeth grinding. These are the sleep conditions that we look here in the sleep center. So that would include those who snore, those who have obstructive sleep apnea, those who they snore and they stop breathing at night, those who sleep too much during the day, maybe they have narcolepsy, which is more of a central sleep disorder, it's more of a neurologic problem, and those suffering from insomnia, especially among, we call them shift workers, because they work during the night and not during the day, so their schedules are a bit turned around, and those who suffer from jet lag. Aside from that, we also treat patients who have abnormal movements during sleep. They sleepwalk, they grind their teeth, they have nightmares, things like that. The treatments includes from medical treatment to mechanical treatment, like we put them on a device. One of my most memorable patients was actually a child who was suffering from obstructive sleep apnea. The mother came to me because suddenly her son became very irritable, having violent behaviors, used to be an honor student, but starting to fail during that quarter. So we did a test and he was positive for sleep apnea. And I recommended surgery, so we did the surgery on the child. And just within a month's time, the mother noticed that there was a significant change in the behavior of the child and the school grades. So that's why we prefer, not that we prefer, we put significant effort in diagnosing children with sleep apnea.
With the Comprehensive Sleep Disorder Center, you will finally be able to wake up from the nightmare of having sleep problems. Visit St. Luke's Comprehensive Sleep Disorder Center and discover how our expertise will help you sleep soundly every night. St. Luke's Comprehensive Sleep Disorder Center, the expert in promoting better sleep for better health. Ultimately, it is expertise.